right. So today we will see our goal, objective, and approach. We will briefly go through the approach that what is the relatively best approach to do these scenarios. And there are 5 stations that we are going to cover: urethral catheterization, ABGs, IV cannulation, venipuncture, and cervical smear. Uh, in in the last 4 scenarios, ABGs, IV cannulation, venipuncture, cervical smear, the approach would be almost same. But in urethral catheterization, there is slightly different because in urethral catheterization, we have to take history before performing this procedure. So we will see how we can do this scenario. Moving further, so today's our goal is to perform procedure with relevant history in given time. Okay, these procedures are usually performed in more than 8 minutes or 10 minutes. So we will see how we can manage our time while performing these procedures. And we have to take minimal history. That is our important objective and goal as well. So objective is same like the previous one. We have to deliver our clinical knowledge while being a safe and a kind doctor. Let's see what kind of questions do we see when we are standing outside the cubicle. So when you have 90 seconds, you have been standing outside the cubicle, you will see this kind of questions. Who you are FY2, and where you are emergency department, or sometimes in the ward as well. We will see one by one all those scenarios. And to whom you are addressing. It is important. It's Peter Jefferson, and he is 65 years old. So when you enter into the room, it is better that you just remember the name of the patient. So when you start greeting, you name the patient, like, hello, Peter. That gives a good impression that you have understood your task and you have read the task carefully. And this will also makes a good interaction with the patient. And he's 65 years old. That is also important because sometimes in the history questions we have to ask patients who are above 60 about how they are dealing in their home chores and how what kind of difficulties they are feeling living alone. Either they are living alone or they are living with someone. And the fourth and the most important thing is, what is your task? In this scenario, look, take history while performing the procedure. So your task is to perform procedure and to take relatively, like you have to perform the procedure and also take the history. So you have 2 tasks in this scenario. And remember, in some scenarios, like in ABGs, you will see that in the task, it would be written that the patient is having shortness of breath. Shortness of breath is a symptom. It's not the task that you are given. So don't ask too many questions about shortness of breath. We will be discussing about shortness of breath as well in ABG scenario. So let's move further. Okay, it's relevant and defined tasks. So I have divided our tasks in 2 subgroups: relevant tasks or defined tasks. In some scenarios, like here, take history while performing the procedure or perform relevant task. If it's written that you have to perform relevant task, then you have to take minimal history. You have to prove that you are going to perform this procedure. Let me give you an example. For example, if it's urethral catheterization and it's written outside that you have to perform relevant task, some knowledge will be given outside the cubicle in the question that the patient has not been able to pass urine for the past 24 hours. So it is likely understood that there is a problem with the pee. And when you enter into the exam, into the cubicle, you have to ask few questions. And then examination is important. For example, abdominal examination, you just have to mention it to prove it that there is urinary retention, so that you can pass, you can do the relevant task, you can do the relevant procedure. In other scenarios, it would be clearly written in the task that you have to perform ABGs, either you have to take blood samples or blood cultures, or you have to do cervical smear. So if it is defined, then there is no need to take history. We will see how we are going to approach those scenarios. However, if it is not defined, it's written that just do relevant task or relevant procedure, then you have to ask few questions to build a narrative that you are going to perform a specific procedure. Okay, now you have spent good 90 seconds outside the cubicle. Now you are going to enter into the room, have a smile, be confident, introduce yourself, including your name and role, and confirm patient's name and date of birth. After that, state the purpose. Hello, it's Peter. Hello, Peter. My name is Dr. Junaid. I am one of the junior doctors here. How are you? All right, and I am here to pass catheter. I am here to do ABGs. I am here to do. I am here to collect blood samples. Just tell the purpose initially. And in some scenarios, the approaches are different. We will discuss, because if the patient is fine, he's sitting on the chair, then you can use this approach. However, if the patient is in pain and he is moaning or he's just not comfortable, then you cannot start like this. So we will see how we are going to approach those scenarios. Then check indications and contraindications. Obviously, whenever you are going to perform a procedure, you have to check those. For indications like in urethral catheterization, there should be urinary retention, and for other like in ABGs, there is a shortness of breath, and in all those scenarios, there would be indications, and the contraindications. In some scenarios, like in speculum examination, the active menstrual bleeding or pregnancy, these are contraindications. You cannot perform. You have to make your own questions and ask these contraindications to rule out, to show the examiner as well, and rule out all the contraindications just for the sake of the procedure. Then, important thing, explain what you are going to do. You are going to pass a thin flexible tube called catheter, and it should not be painful. Can I proceed? Can I pass this? It would reduce your abdominal pain. It would reduce your distress. So can I proceed? So that's how you take consent. And then I understand that it is we are going to pass catheter in your private parts. So there would be a member from the staff called chaperone, and chaperone will be here. So offer chaperone and take consent. These are important things. You have to mention these things. People often forget about taking the consent and offering a chaperone. Then there are a few questions, like pre-procedural questions, like in ABGs, in IV cannulation, or in Venepuncture. The scenarios in which you are going to prick. In these questions, you have to ask arm preference, bleeding disorders, and needle phobias. In almost all the questions, they would say that doctor, whatever you like, which arm do you like, and I do not have any bleeding disorders, and I do not have any needle phobias. But you just have to show the safety of the patient. You just have to mention that I am going to ask these 3 questions. Then start your procedure. Either you are doing catheterization, cannulation, or venipuncture, and giving warning shots. When you are going to prick, give a warning shot. When a sharp scratch is coming, when you are going to like put catheter, give warning shot. I'm going to insert catheter. When you're going to insert local anesthetic, just say that I'm going to insert local anesthetic. Just whenever you're going to touch, whenever you're going to do any procedure, just give a warning shot to the patient, so that he become aware that what is going to happen now. Then at the end, say thank you after performing the procedure. And in some procedures, you have to ask if there's any pain, just let me know. Like in if you are passing catheter, or if you are passing catheter, then you have to ask it if there's any pain, just let me know. And then at the end, again, important thing, document and label what you have done. Document each and everything, and label if you have taken samples for the blood culture or for paracetamol poisoning. We will see a scenario with the paracetamol overdose. So label those with the patient's name, NHS number, and date of birth. And last, again, this is also important, sharps and sharpen. Do not discard needles, sharps on the table. Do not let left those needles on the table. You will lose marks if you left those needles on the table. So always discard sharps in the sharp bin. Then in the question, it would be written that discuss management with the examiner or with the patient. If it's not written, then inside the cubicle, either the patient or the examiner would ask you, doctor, what you're going to do now, or what is going to happen to me, or for how long this catheter will remain there. They would ask number of questions. So in that window, you are going to discuss management options. What management options do we have, and how we are going to proceed further? Either we are going to admit you, or either we are going to send samples to the lab, or we will be waiting for the results from the lab. And again, let me summarize. You are standing outside the cubicle. You have good 90 minutes, good 90 seconds. Just use those 90 seconds and just remember the patient's name, age, and the task which you have been given. Enter into the cubicle, have a smile, confident, and greet with the patient, and then state the purpose why you are here. Check indications, contraindications, take consent, ask for chaperone, and then proceed further to the procedure. Ask 3 questions, important questions, and then while performing the procedure, always give warning before doing any step that is related to the patient. And then at the end, sharps in the sharp bin, and document and label everything. Discuss management with the patient or the examiner. So I have written here some of the common mistakes that people do while performing these procedures. They take too long history. If in the question it is written that there is a patient with who is 30 years old and he's here with the shortness of breath, explain and take ABG sample. Now your task is just explain what is ABG and what you are going to do now. You are going to take a sample. The history has been taken by someone else, by some other doctor. So your task is to do the procedure. I have seen that the patients, the candidates spend almost 8 minutes on taking history of shortness of breath and making diagnosis. It's not your task to take history of shortness of breath. Your task is to do the procedure. And then people do not take consent and offer chaperone. It's also important. Always take consent whenever you're going to explain the procedure. Just take consent immediately after explaining the procedure, because this is the best time. You are explaining to the patient that what we are going to do now, what I am going to do now, and this is this, and now can I proceed? It's the one way to take consent. Remember, you can alter your own sentences, you can make your own sentences, whatever you like, but stick to the approach. Always try to do things in stepwise manner so it looks natural. And people do not discard sharps in a sharp bin after performing Venepuncture. They place needles on the table and they think that the container or the bottles are important and the labeling is important. They do not discard sharps in the sharp bin. Remember, it is also an important step. And do not warn patient whenever they are going to scratch or prick or insert needle for venipuncture or IV cannulation. They do not warn the patient. A sharp scratch is coming. Always warn the patient whenever they are going to insert catheter. Always verbalize it. I'm going to insert catheter. I'm going to insert this flexible tube. And improper techniques. Sometimes they miss steps. And well, we will be discussing about catheterization. I will tell you a little different approach that how to memorize those steps. As I understand that in the stress people, it is easier by performing clinical settings, but in the exam, there is a stress. And due to that stress, people often miss steps. So we will be seeing that how to cope with it and how to memorize those steps. And non-sterile techniques. They do not care for the sterility. For example, in urethral catheterization, people often touch catheter. However, you do not, it's sometimes you lose marks, you lose maximum marks, and they can fail you as well on touching the catheter because you are breaking this protocol and you are threat and you are just not following the universal sterile protocols. So do not touch the catheter. We will be discussing it after a while. So this is a simple approach for today's scenario, which is a practical scenario. First, you have 90 seconds outside the cubicle, enter into the cubicle, greet with the patient, state purpose, and then indications, contraindications, and take consent, chaperone, perform procedure, check patients, warn the patient whenever you are going to do a step on the patient, and then label, document, thank patient, and discard everything. Sharps in the sharp end. Do not forget this. So this is the simple approach that we're going for 5 scenarios that we're going to do now. So the first scenario is urethral catheterization. So you are FY2 in emergency department, and Mr. Peter Jefferson, 65-year-old man, has presented with abdominal discomfort. He has been unable to pass urine since yesterday. This is important. And take history while performing the procedure. So you are standing outside the cubicle. You have good 90 seconds. One thing is clear that he is 65 years old. Second thing, there is an abdominal discomfort, pain or distress in the abdomen. Third thing, unable to pass urine since yesterday. Just something is clicking to the mind that it could be urinary retention. It could be something else as well, some abdominal pathology, but one of them is urinary retention. Take history while performing procedure. Special note is perform relevant procedure. So there is a special note, perform relevant procedure, and you have to take history while performing the procedure. Okay. So now outside the cubicle, you have 4 to 5 things to focus on. Peter Jefferson, 65 years old, abdominal discomfort, has not been able to pass urine since yesterday, and perform relevant procedure and take a little bit history. Let's see how we're going to approach this station. Okay, setup. So this station comes in 2 ways. One way is that Peter Jefferson would be leaning forward, having hands on the abdomen and crying with the pain. He would not be seeing you. He was just looking down to the foot, to his feet, and he would not be seeing you. So this is one thing that when you enter into the room, you will see the patient will be sitting like this, leaning forward. And the other way, the patient wearing a hospital gown and laying on the couch. There are two different scenarios. But nowadays, it's coming with the first one. The patient would be leaning forward and with the hands on the abdomen, and will be like seeing his own feet. Okay, so there's some patient information. A patient would have abdominal pain, suprapubic pain, no burning sensation. Okay, we will be discussing it when we will approaching how we are going to do this scenario. So we will be discussing what's in the patient information. Approach. So again, you have spent good 90 seconds. You have 4 to 5 things in your mind. Everything has been mapped in your mind. You enter into the room. There you greet, you introduce yourself that my name is this and I am one of the F2s, I am one of the doctors here. And so now you have entered the room and the patient is not looking at you. Now your approach should change a little bit. You know the patient's name. He is Peter Jefferson. Hello, Peter. My name is Dr. Junaid. I am one of the doctors here. Okay, he's not looking at you. And he's crying with the pain. You can start it like this. I can see that you are in distress. You are in pain. Bear with me for a few seconds. I am here to help you. So this gives, look at this. So this gives a good idea to the examiner that you are picking up the clues. The patient is in pain. You are not just a robotic. You're not just entering into the room and starting like, please tell me your name and your date of birth. No, you have just picked a clue that patient is in pain and you have addressed it like in a very good way that I can see you are in distress, you are in pain. Bear with me for a few seconds. I am here to help you. Okay, now Now the name is confirmed. Can you please confirm your date of birth? Okay, then continue. Where exactly is the pain, Peter? So for how long you are having this pain, and is it the first time you are having this pain? In this scenario, the patient would answer your 3 to 4 questions, and after that, he would not answer. He would just cry with the pain, doctor, I'm having pain, just do something. So you have read outside this scenario that the patient has been unable to pass the urine, and there's abdominal discomfort. Now you are taking history of abdominal discomfort. Where's the pain? For how long? And is it the first time? It's in a suprapubic region. It started like 6 to 8 hours ago. And yes, it is the first time. Patient would answer like this, or he may change answers. Remember one thing, GMC is changing scenarios frequently. They add new things, they remove previously, like the things that has been given in previous scenarios. So just be careful. Your just main task is to just take a little bit history to prove it. You are now going to perform procedure. For procedure, you are going to prove that it's urinary retention. I will just tell you how to prove it now. Okay, now it's another things have been added into your knowledge that the pain is suprapubic region. It's most likely urinary pain, a bladder pain, and for how long? 6 to 8 hours and 24 hours have been passed. He has not passed urine, and it's the first time. Okay, to rule out the DDs, like any trauma in your private part or any blood additives of the penis, you can ask this. And when did you pass urine? Now confirm this. You have read outside that he has not been able to pass urine for 24 hours. Now confirm. Okay, doctor, I couldn't pass urine since yesterday. Now it's confirmed. Okay. When did you pass stool? Just to confirm either it's a spinal cord trauma or not. It is possible that it's a spinal cord trauma and he has not been able to pass stool or urine. So your report will be different. So just rule out, show that I'm a safe doctor. Now, if the patient is crying with pain, now if he is not willing to answer your more questions, you will stop here. You will just jump to examination. Now, Peter, I can understand that you have not been able to pass urine for since yesterday, and you are having this suprapubic pain, just pain in your tummy for 6 to 8 hours, and it's the first time. And so I will quickly examine you. And what examination you are going to do? Vitals, abdominal, and perectal. When you will mention these examinations, the patient or the examiner would hand over to you some notes. On those notes, it would be written that abdomen is distended, bladder is palpable. It would be written on the notes. Now you have, you know that patient has not been able to pass urine for the last 24 hours and everything is in your mind. Abdomen is also distended and bladder is palpable. There's dullness over percussion and perectal examination. There's enlargement of prostate. It would be written on the pages that would be handed over to you. Now it is proved that it is urinary retention. How? History part. Secondly, examination part. These two things are the proof that it's urinary retention. And again, let me summarize it. You enter into the room. Okay. I need to just turn off my video. Okay. So you enter into the room and okay, so patient is in pain. I can see that you are in pain, you are in distress. Bear with me for a few seconds. I am here to help you. Okay, now where is the pain? For how long? Is it the first time? And when did you pass urine last time? Any trauma to your private parts? 4 to 5 questions and then jump to the examination. I would like to check your temperature, pulse, respiratory rate, and blood pressure. And abdominal examination and perectal examination. So you will be handed over a few pages, 2 pages, and you can check the findings. It would not take you more than 1.5 minutes. Okay. So it will not take you more than 1.5 minutes. Now you proceed for the procedure. Briefly explain that what you are going to do now in a friendly language. I need to insert a catheter. This will involve inserting a thin flexible tube into the penis to reach the bladder. The procedure will feel a little uncomfortable, but shouldn't be painful. I will insert local anesthetic into the penis to make the procedure as comfortable as possible. You can make your own sentences. You can explain everything in patient-friendly language in your own words. So it's not like that you have to just follow this approach, these sentences. So you can make your own sentences, okay? Now is the time to take consent and offer chaperone. And one of the staff members will be present throughout the procedure, acting as a chaperone. Would that be okay? And can I proceed with the procedure? Now wash your hands and wear apron. It would be assumed, it would be written on the paper. And again, ask the patient if there is any pain, then just let me know. Now gather your equipments. Your equipment would be this kidney tray, gallipot, gauze, cotton balls, bag, sterile water, local anesthetic, and this drape. In the real examination, you will not be had these absorbent pads and gloves. It would be assumed. So after the equipment, now you have taken the consent, everything is going fine. Your main task was to take history and perform the procedure. Don't forget this. Your main task was this. But one thing is that the patient would be crying. He would not give you any history. So you will stop there. You will pass the catheter. When you will pass the catheter, he will say thank you to you. Then you can take history. You will give a pause of 1 minute there by performing the catheterization. So you have all your equipments there, and you go to the patient and then start passing catheters. So the technique is simple. First part is the cleaning. You have to just this is the gallipot, this is a gauze. You have to hold the penis from the gauze and then clean it with the cotton balls. And then again, you have to drape it, and then you have to pass catheter. For that, before passing catheter, pass silocaine gel. I will be showing you a video that you can have understanding how to do this catheterization. And then after a local anesthetic, pass catheter. And when you are going to pass catheter or local anesthetic, you just warn the patient that warn the patient that local anesthetic might initially sting, but should quickly cause things to become numb. Warn the patient that I am going to insert this flexible tube. Okay, 2 times you have to warn the patient. And then obviously put some sterile water for balloon inflation, and then at the end attach catheter back. And the final steps: dispose everything that like the drape or the cotton balls into the waste bin. Whenever you're going to use the cotton ball, just throw it into the waste bin. Okay, then document details, procedure, patient's notes, everything. These are the list that I have made, and you have to just mention 2 to 3 things, like details of the patient and the size of the catheter and the color of the urine. The 3 to 4 things. You will not have enough time to state all these things. Now, when I was preparing for PLAB 2, I made this, when you're performing in the real exam, it is because of the stress, you miss out some steps. Some people miss dripping, some people miss cleaning. So when I was preparing, I made these 4 things, 4 steps. The 4 steps are necessary to perform urethral catheterization: cleaning, draping, catheter, and bag. So I divided these in 4 steps. How? I divided equipments as well. Gallipot is for cleaning, drape is for draping, and kidney tray is for catheter, and there's a urine bag. Now how to remember this? Okay, so you you have all the equipments in front of you. Now you're going to pass the catheter. First, use gallipot. Whatever in the galliport, you have to use everything, and you have to utilize three things. One is the gauze piece, other is the cotton balls, and third thing is normal saline. Put some normal saline into the onto the cotton balls, and then take one gauze piece and hold penis from the gauze piece and start cleaning from the meatus to upwards penis, and then throw cotton balls into the waste bin. There is a possibility that there might be there might be something to hold, like the forceps. If there's a forceps, then you can hold cotton balls with a forceps. Otherwise, you can hold with the hand. And then galliport is finished. Cleaning part is finished. Whatever in the galliport, just put it aside. And then second part, what is it? Draping. Drape it. Third part, whatever in the kidney tray. The kidney tray would include catheter, local anesthetic, and sterile water. Three things. Again, galliport, three things. Kidney tray, three things. Now, how to use these three things in kidney tray? First, put the kidney tray under the penis, so that if when you are going to pass catheter, whatever the urine comes out should be in kidney tray. So now the three things. The first thing is catheter, local anesthetic. Pass, give warning shot, pass local anesthetic, and then wait for, just verbalize it. I will wait for 3 to 5 minutes. We will not have enough time to wait, just verbalize it, and then start passing catheter by a non-sterile technique. Do not touch the catheter at any cost. If you will touch the catheter, you will lose marks. Hold the penis. I will show you a video how to pass catheter while there is a wrapper on it. So pass the catheter, you will feel a little bit resistance when passing through the prostate. So after passing the catheter, then you need to inject sterile water. Okay, so three things has been done, and then let the urine comes out into the kidney tray. 3 steps: galliport, cleaning, draping, and then kidney tray. 3 things: a local anesthetic, catheter, and sterile water. And then last thing, which is bag, attached bag with it. And on the bag, you have to write down the patient name, the color of the urine, amount of the urine, and all those things. Whatever you remember, just verbalize it, because there will be no marker. If there's a marker, then you have to write down everything. If there's no marker, then there's no need to write anything, just verbalize it. So this is a simple approach to do urethral catheterization. You may be able to do this catheterization in 3 to 4 minutes. Now you will have 2 minutes. In the last 2 minutes, you have to discuss management, either with the patient or with the examiner. What you're going to do now? You're going to admit under urology. You cannot say this, I'm going to, okay, you can say this, but it doesn't feel right that I'm going to admit you. No. Again, take permission. Would that be okay for you if we admit you in the urology? Because there might be possibility that someone else in the home that he is looking after, or he has to do some important work. At this point, patient will discuss with you what important things he has to do, or what relatives he has to inform. So at this, you have to just take permission in a way that he could talk to you, he could say something to you, so that you can pick up the point and you can discuss it later. Like, would that be okay for you to get admitted into the hospital? Then comes the investigation part. Okay, we are going to some investigation, which include your complete blood count, your salt in the blood, and how well your kidney and liver are functioning, and urine dipstick to check for any infections. Because he was holding urine, there might be possibility that there is an infection going on. Okay, then discuss long-term management. Okay, so we will be starting you on tamsulosin. This is a medicine. You know why you are having this retention? Because there is a gland called prostate. When you will mention about prostate, he would say, doctor, I know one of my friend had this prostate problem. Okay, so you know this prostate, this is a gland that sits at the base of the bladder. It enlarges, and when it enlarges, it blocks blocks the bladder. That's why, because that is why you had a problem in urination. So when you will mention this, so this medicine will shrink that gland, and you will not have any problem while urination. So now you have explained it as well, and you have stated that we're going to give you some medicines as well. The medicine, the management part comes like this. You will have 2 minutes, almost 2 minutes, or 1.5 minutes, I guess. And then if the medicine fails, we will see for 2 weeks or 4 weeks, then we will do an operation called TURP, transurethral resection of prostate. We will discuss this after if the meds fails. Do not go into discussion. If the patient asks, then go for discussion. If it doesn't ask, then there is no need to go for discussion. If you need an urge to explain it to the patient, then you can ask the patient that, would you like to know more about this procedure, this operation? Otherwise, just mention that if med fails, we are going to do TURP. And then trial without catheter. What it means? It means that after 2 days, we will remove your catheter. We will see either you are able to pass urine on your own or not. So this is the management, and there are some indications I have written here. Urinary retention, if more than 1 liter of residual volume in the bag, residual urine, and abnormal renal functions. If any one of them, then you are going to admit. What's their indication? There's a urinary retention, so we are going to admit the patient. So there are common mistakes. There are people take too long history. We're discussing it later. Okay. So let me summarize it. What's urethral catheterization and how you're going to approach this scenario. Always patient would be in pain. Either he's on the couch, either he's sitting on the chair. The most frequently, which is coming with a chair, that patient is having abdominal distress, and he would be looking downward and having hands on his abdomen. So you will have good 90 seconds outside the cubicle. You know that the patient has not been able to pass urine. You enter into the room, greet the patient. I understand that you are in distress. I'm here to help you. Where's the pain? For how long? Is it the first time, or is it increasing with the time? When did you pass urine last time? Did you suffer any trauma? Okay, so now I would like to examine you. My examination will include taking your temperature, pulse, respiratory rate, and blood pressure. And I would like to examine your tummy and your back passage as well. Take permission. Can I proceed? Okay, so examiner would give you findings, the abdominal distension and enlargement of prostate. I can see that you are having urinary retention, and you are having the pain because of this. You are unable to pass urine, you are having pain because of this. So to reduce this pain, I need to pass this thin flexible tube. So it would not be painful. I will be giving you numbing agent. Can I proceed? Okay, prepare your equipment, divide in 4 steps: cleaning, draping, kidney tray, and then urinary bag. Cleaning 3 things: gauze, 2 cotton balls, and then normal saline, and then draping, and then kidney tray, 3 things: insert local anesthetic, wait for 3 to 5 minutes, and then pass catheter, non-sterile technique. Do not touch the catheter, and pass, and then inflate balloon by inserting sterile water, and then at the end attach bag. This is a simple technique in 4 steps. You will be able to do in 2 minutes, then discuss management. Or if you are not able to take history in the beginning, then you can take the remaining part of the history that's there. Do you have any past medical illnesses? Yes, doctor. I was diagnosed with BPH 6 months ago. And you will ask about past medical history. He would say that the BPH, menopause, hyperplasia, 6 months ago. All right. Do you have any allergies? You will ask in the beginning, because sometimes patients have latex allergies. And are you taking any kind of medicines for prostate, or any kind of medicines? Or how is it affecting your life? What is your occupation, and how is it affecting your social life? Who else lives in your house? These questions should be asked at the end. After performing your relevant procedure, then you can take these history, compute your history, and then go for the management and discuss management, what you are going to do now, and that's it. This is a simple approach. You can complete this in 8 minutes. 1 or 1.5 minute initial history, then 3 to 4 minutes for this procedure, and 2 to 3 minutes for remaining history and management. Practice it, you can do it. And common mistakes. People take too long history. People start taking history of abdominal pain, completes everything, like is it radiating towards anywhere else, is it going to back, numbness of the legs. They try to rule out each and everything. When it start, do you have problems with the pee or poo, and past medical history, and about social life, occupational history. They try to ask everything, but they miss the important part, the task that is to perform the procedure. So don't ask too long history. Just stick to the point. You just have to prove it that it is in your attention, then pass catheter. Then you can take history. Missing steps, people miss steps like draping, local anesthetic, cleaning, again because of stress. So just make a map in your mind. Like the first thing that you can do is, the first thing is cleaning, galliport. Second thing is dripping. Third thing is kidney tray. Three things: catheter, local anesthetic, and sterile water. 4, bag. And then do not take consent of a chaperone, again because of stress. Don't do this. And do not warn patient when inserting local anesthetic or passing catheter. So always do this. Now let me show you the video, quick video, so that you have a better understanding what is urethral catheterization. Okay. I am posting this in the comment section. Just watch this video and just let me know. And remember a few things, how they are following the steps. Cleaning, important thing. Draping, that's another important thing. And then how they are passing catheter without touching catheter from over the wrapper. And then how they are going to attach back. Just watch it. Okay, just give me a minute. Okay, I will post all these links at the end of this class. Okay. Okay, everyone else, have you done watching this video? Should we continue? Now I am taking permission. That is important thing. That's great. So you have seen that how do they do the step of cleaning and then draping, and then how do they pass catheter and then attach back? So these are the important steps that you need to remember while performing this catheterization. Okay, let's move towards our second scenario, which is ABGs. You are referred to in accident emergency. Patient has come with shortness of breath. Explain and perform ABG sampling. You are referred to your accident emergency patient, whoever, let's say Peter Jefferson. Okay, and again come with shortness of breath. This is a trap. Do not fall into it. Explain and perform ABG sampling. Your task is explain and perform ABG sampling. You just have to do this. History has been taken by someone else. It is a longer procedure. It would take almost 6 minutes. So you do not go for history. You just make a map outside the cubicle 90 seconds, and then when you are going to enter into the room, into the cubicle, you start with greeting, introduction, introduce yourself, my name is, and my role, and then the patient would be stable, and he would be sitting on a chair. So you ask the name and date of birth and start and continue. Now, it's just a little rapport has been built with a patient. Now, I am here to perform a special procedure called ABG. And what is it? It is I need to take a sample of blood from the artery in your wrist to accurately assess your oxygen levels. Because you are having this shortness of breath, I have to assess these oxygen levels. So just explain what you are going to do in a friendly manner. Just explain briefly about ABGs, what the ABGs are. The procedure does not, it would be painful, but I would be giving you some local anesthetics, just mention it. But in the real exam, you will not be having any local anesthetic. You just have to do ABGs. Okay, then a quick history about allergies, about medicines. Either he's taking warfarin or he's taking any blood thinners. Then you have to take extra care. These history questions are related to procedures only, not to the shortness of breath. Only procedure. Are you taking any kind of medicines, warfarin, or any blood thinners? allergies with the latex or with the needles, needle phobias, or past medical history. If you have ever been diagnosed with any bleeding disorders, again, there are contraindications. Now you would ask about if you are having any skin problems, if there is fistula on your arm, but you just have to ask about skin problems and go on. These are not common contraindications. The patients would be there. You will see the patient there. The patient would be fine, and he would be sitting on the chair. So I have just written these contraindications and related contraindications so that you can have an idea of what are those. Okay, check allergy, gain consent. Now you have explained everything. Now take consent. Can I proceed? And then expose patient's wrist, and then make a position. It's simple sitting position, and then ask if you are having any pain in the wrist. Just you have to ask this question before performing any procedure. Now, pre-procedure questions, there are three pre-procedure questions, same. Arm preference, needle phobia, bleeding disorders. Now, you're going to do ABGs. You're going to prick. There's a needle involved in it. These three questions, when you ask the arm preference or needle phobia or bleeding disorders. Bleeding disorders can be covered in here, in the past medical history. Do you have any bleeding problems, bleeding disorders? It can be covered here. And in the medicine part, you can ask about warfaring. And needle phobia and arm preference, you have to ask separately these two questions. Then gather equipment. You will be having pre-heparinized ABG syringe, and there will be a needle and alcohol wipes, and then gauze, cotton wool, and sharps container. And there is important thing, that is modified Allen test. Remember, in this scenario, you just have to perform procedure. You do not have to take history. So make yourself aware of the situation and perform relevant examination and procedure only. So this is modified Allen test. It is a special test to check the ulnar patency. Okay, so to perform this, now the problem arises. The video I will be showing you, they perform it on a real patient, on a real human. But in the scenario, in the examination, we will not be having real patient or a human. We will be having a mannequin, a dummy. So how we are going to check Allen test? How we are going to perform this Allen's test? So there are two ways. First one is that you ask the patient to make a fist and do Allen test on dummy. Press ulnar and radial, and before pressing, just obviously ask the patient to make a fist, press ulnar radial, and then ask patient to open the fist, and then quickly remove pressing your ulnar artery, and then check the patency. This is the one way. You just have to verbalize this. I am going to do modified Allen test. Could you please make a fist and then press it? I'm going to release pressure from your one side of your hand. Okay, so that's how I will check ulnar patency. Just do this and move forward. This is one way. Second way is that you do it on the dummy. You do not involve patient. I will ask a patient to make a fist. I will press ulnar and radial. Could you please, I will ask patient to open fist, and then I will release pressure from ulnar artery and then check ulnar patency. That's how you can verbalize and you can check ulnar patency on the dummy, or how to involve patient or how to not involve patient. There are two ways you can do modified Allen's test. And then after doing this, you can read further about modified Allen test. Here I have written all the details. What is Allen's test and how it is performed? And it is performed to check ulnar patency. If there is no ulnar patency, then we do not perform ABGs on that hand, in that specific hand. And then there's again positioning, and there is palpation. Palpate radial artery. You have to perform EPGs from radial artery. First palpate, and then clean, and then prepare your needle. Now, In the video part, you will see that they palpate and then they prick blindly. It in real clinical settings it is difficult. You can put your two fingers and then you can go between your two fingers, like we do in our clinical settings. That is also acceptable, but do not touch the area which you have cleaned with the swab, because you have to take care of sterility. So that's how you're going to prick. And then before pricking, warn the patient, a sharp scratch is coming. Okay, and hold the needle. You will see that the needle will be filling on itself. And then just complete your procedure and remove the needle from the syringe and discard in sharp spin. And place a cap on the syringe and just explain to patient that I will go and I will come back to you after with the results. And then at the end, again, dispose of your PPE or gloves. But in all these scenarios, you will be gloved. You will be assumed that you are gloved, and then document. Documentation is important. If there is a marker, then document. If there's not a marker, just verbalize it that I am going to document. Okay, so this was a simple approach of ABGs. In this scenario, you do not have to take history of shortness of breath. Just go and do your procedure and just sit relaxed there. So what you're going to do in ABGs, first you enter into the room, you have good 90 seconds. You have read about this task, what is going inside, and it's clearly written that it's ABGs, explain and perform. You enter into the room, greet, smile, confident, and ask the patient's name and date of birth, and then I am here to perform a special test called ABGs. I need to insert a needle to take blood samples and to check gases in your blood that would help in the treatment. So can I proceed, take consent from the patient, and then ask people procedure questions like arm preference, bleeding disorders, or any allergies, or taking any kind of medicines, these 4 or 5 questions to rule out any contraindications. And then start your procedure, start with the modified Allen test, do it on the dummy, either involve patient or do not involve patient, and then do the ABG sampling. Prick it, give warning sign, I'm going to prick. You will not feel, you will feel sharp scratch, or you will a little bit pain. Then you have done your work, your task, sharps into sharp bin, waste into waste bin, and then document, say thank you to the patient. I will come back to you after with the results. That's a simple approach of ABGs. Okay, let me show you the video. So you will have a better understanding how it's done. Okay, watch this video and see how it's done. See how they do modified Allen test, how they perform this APG sampling, and before pricking, how they give warning, a sharp scratch is coming. You need to see these things and use of sharp spin. So watch it and Okay, that's great. Look at this. This is one approach. Now he has placed his one hand towards the knee, towards the elbow. You can place your two fingers in both sides of the needle, and you can perform ABGs like this, like we do in our clinical settings. But do not touch this area where you are going to prick. Do not touch this area because of sterility. And let me show you one more thing. This. So this is the cover of the needle. You need to cover it and then discard it in the sharp spin. You have to perform these steps. Okay. So let's continue with our next. This is IV cannulation. Okay. So this is our third scenario. In this scenario, the patient, you have a two doctor in acute surgical unit. Patient is Robert Wilkinson, 27-year-old man, had an appendectomy 6 hours ago following a burst appendix. He was on intravenous fluids that have now been stopped due to blocked cannula. He has vomited several times and he is in severe pain. Please assess the patient, insert IV cannula, and in last 2 minutes, discuss management with the examiner. Now, your task is assess patient, insert IV cannula, in last 2 minutes, discuss management with the examiner. You have three things in your mind. You're standing outside the cubicle, you have three things. You have to enter into the room, assess patient. What do you mean by assessment? Take a small history. Check what's going on. Check notes, drug charts, what medicines are have been given to the patient. And insert IV cannula. The cannula has been blocked, so you have to insert a new one. So insert IV cannula. And in last 2 minutes, discuss management with the examiner. So there should be a proper map in your mind that how you are going to spend your time inside the cubicle. You have 6 minutes, remember. So again, you enter into the room, smile, confident, and state your name and role, and check patient's name and age, date of birth. Okay, he is in pain, but he would be responding your questions. That pain would not be that severe that he would not be answering any questions. Okay, so he would be answering your questions in this scenario. Now, assess patient. How are you going to assess patient? Ask briefly about the pain. Okay, where exactly the pain on the surgical side? Obviously, appendectomy was done. So surgical site, and what analgesia have been given, what is the severity of the pain, when was it given the analgesia, and there might be a possibility that it was given 1 hour ago or 2 hours ago, or what was the dose. You can check on the drug chart if there is any, and check for any allergies. If you have any allergies, then state that I am here to pass cannula so that we can give you fluids and painkillers so that we can reduce your pain. Would that be fine for you if I pass this cannula or this needle or thin tube? Because the cannula has already been passed to him and it has been explained that what his cannula looks like. You just have to explain it in 1 or 2 sentences and then take consent. Again, you enter into the room, ask briefly about the pain, where exactly the pain, for how long, and what medicines have been given. Check drug chart if there is any, and then check for allergies, and then take consent. Now, again, pre-procedure questions. Ask preference and if you have any bleeding disorders. Okay, so now gather equipment. Your equipment in this would be
मेरा फोन पता नहीं क्या कर रहा है, ऐसी खामा बटन
procedure, tray, tourniquet, cannula. Okay, sterile dressing pack and tegaderm. Tegaderm is important. I will show you how tegaderm looks like in gauze swab and normal saline and syringe. You just have to now position the patient and ask the patient before the pain, and assume you are gloved. Everything is there. Choose the vein. Just do it quickly. Palpate the vein and then apply tourniquet. 4 to 5 fingers width above the planned cannulation site. Okay, and then palpate, and then I will show you the video how to perform this IV cannulation. But at this time, I will just be repeating the steps what you are going to do. And then before passing needle, warn the patient sharp scratch is coming, and quickly pass the needle, and you are done with cannulation. Now apply tegaderm. How tegaderm looks like? Tegaderm is okay. There it is. It's a tegaderm. You have to apply it on the cannula. To hold the cannula, there would be a name and address and NHS number as well. You have to document name, address, and everything on the tegaderm. This is the important step people usually forget, to apply tegaderm and how to apply it. You can practice it. You can buy it from any medical store and practice it on any mannequin. And then flushing it, and thank the patient, and wash hands and document details. Okay, I'm sorry, it was disconnected, I guess. This screen. Okay, that's fine. Okay, previously it was disconnected, I guess. Okay, so that's how you're going to perform this IV cannulation, and I will show you the video in a while. But important thing is, you have discussed management with the examiner. Patient is post-appendectomy, so he is in pain. You have to give fluids and painkillers. So you will start it like this. I will take care of ABCs, observations, and I will give painkillers. 5 mg of IV morphine every 4 hours. Write it down on the drug chart, or you just mention it. And antiemetics because he's vomiting, and fluids. Paracetamol to reduce temperature. And this is the proper management guide. Monitor urine output, send blood samples, discuss with the seniors, and explain what you are suspecting it's peritonitis, and the patient would need a broad spectrum antibiotics. You need to explain all this in your own words to the examiner in last 2 minutes. Like how I'm going to take care of this patient. And remember one thing, he has already been admitted in the ward. There's no need to verbalize again that I am going to admit patient again. That's how you perform this IV cannulation. Remember, you are standing outside, and you have to perform to do IV cannulation. You enter into the room, you check, you just state the patient that I'm here for what purpose, and I'm going to pass do this IV cannulation, take consent, 3 questions, and then pass cannula. Warn the patient when you're going to pass cannula, sharp scratch, and document everything and discuss management with the examiner. Let me show you the video. Okay. I understand that. I know that it on the online it is difficult to perform procedures. Procedures are usually done in person. So this is one way to learn, but I can give you only an idea that how to perform these procedures. So just go through this cannulation, and we will move forward to our next scenario after this. That's great. Okay, so our fourth is the venipuncture. First name is venipuncture. It's very important. It's PCM overdose, paracetamol overdose. So we will see how we're going to do this. Okay, you are referred to an emergency department. Jane Wright, 25, has been brought to the hospital following an overdose of 40 tablets of paracetamol 6 hours ago. And remember one thing, paracetamol dose can be detectable in blood after 4 hours. So always this time would be more than 4 hours, 6 hours. So before 4 hours, you do not perform any blood sampling because paracetamol levels cannot be detected. So perform venipuncture for necessary investigations, talk to the patient, take relevant history, discuss about further management with the patient or the examiner. So your main task is perform this venipuncture and take relevant history and discuss about further management, what we are going to do now with the patient examiner. Three things: venipuncture, relevant history, and what we are going to do now, management part. So you do not have to perform any mental state because there might be a psychiatry review involved in it. So you do not have to take this. You do not have to perform any mental state or any mental examination. Assume you are gloved. In all those scenarios, in all the 5 scenarios, in practical procedures, you would be gloved, assumed. Now, you have spent good 90 seconds outside the cubicle. Now you enter into the room and you state you introduce yourself, and then you make acquaintance with the patient. And after that, patient would be talking, he would be answering your questions, and there would be no pain, nothing else. You just have to start taking history. Can you tell me which tablets you look? An important thing, do not ask why the 2 tablets. You are not here for psychiatric review. You are an emergency department. Your main focus should be paracetamol overdose, not about the psychiatric questions. That is important thing. Just focus on paracetamol overdose. So there are few history questions that I have written here. Can you tell me which tablets you took, how many tablets, and when did you take, and with water or with some other liquid, or do you have any liver problems, because it affects liver. If the patient is already having liver problems, it can damage liver very quickly. And any regular medications are you taking, any allergies do you have, or any medical conditions? This is MAM, medical, past medical, allergies, and medications. The important question, the short history that you have to take in emergency department. In emergency department, you do not have to take history about social life, about occupation, about, you do not have to ask about eyes, why you are having these symptoms, or what do you think you are having this. No, in emergency department, you do not ask such kind of questions. You just stick to the focused history, 3 to 4 questions about the symptom, about what about the incident, and then past medical, allergies, and medications. And then summarize. I need to take blood samples, which involves inserting a small needle into your vein. You may briefly experience a sharp scratch as a needle is inserted. So you have explained it very nicely to the patient that I'm going to insert a needle. Now, it's because I need to check paracetamol levels that you have taken tablets 6 hours ago, and explain that. Okay, so now you have explained what you're going to do and what we are going to look into the bloods. Now take consent. Can I proceed? Without consent, you cannot do anything. So always take consent. Pre-procedure questions. Do you have any arm preferences, needle phobias, or bleeding disorders? How are you with needles? And this is your equipment needed. Tray, tourniquet, vacutainer holder. This is vacutainer holder. This is vacutainer needle or butterfly. There is a needle as well, but it's not shown in this picture, but there is a needle as well. Vacutainer, the tube. The vacutainer is the, okay, I will show it to you. Okay, this is vacutainer. It's just a tube having yellow or purple color, which we store blood. gauze, alcohol swab, sharps bin, and clinical waste bin. This is our equipment that are needed for our procedure. Now, start procedure. Apply tourniquet. Palpate vein, clean vein in round motions. You just watch the video, you have an idea that how to do this procedure. Important things. We will skip to the important part. We will perform the patient, and the important things in this procedure are inform patient, warn patient a sharp scratch is coming, and then label the vacutainers, what's inside. And remember, paracetamol samples goes into yellow vacutainer. There are different colors of vacutainers. We will be discussing about those colors as well. But remember, the paracetamol will go in yellow. All right. So if you fail on the first attempt, excuse and ask to try again. Use new materials. If you fail to take blood on the two attempts, tell you are unable to, and I will ask my colleague to take samples. And sometimes examiner would say, proceed without taking blood. What you are going to do now? Ask paracetamol. Okay. So now you have taken blood samples. You will also realize that I would like to do other investigations, which include complete blood count, liver and kidney functioning tests. Liver tests are important, and salts in the blood. When you will verbalize these tests, examiner would give you some results. Either it would be 94 or 84. Look at this. After 8 hours, it would be either less than line or above the treatment line. Okay, it would depend upon the situation. They alter each and every time. Now, you will be having this nomogram inside the cubicle. Okay, you have taken the blood samples. You will be having this nomogram inside the cubicle. If the paracetamol levels are above treatment line, you are going to start treatment. You will, because now you are interacting with the examiner, you will say it to the examiner, or if the patient gives you the result, you will say it to the patient that I will start your treatment with N-acetylcysteine. You will be get admitted in 21 hours again. Then again take consent, but okay, then I will be giving you N-acetylcysteine at 150 milligram. This is the rate that you have to give. First hour 150 milligram per kg in 200 ml of 5% glucose, then next 4 hours, then next 16 hours. So it's 21 hours. And in between, we will be continuing assessing you, taking your vitals, or if needed, taking your blood samples, checking paracetamol levels, and checking your liver functions. I will say this because you have high paracetamol levels in the blood. So you know what are the complications. It can lead to liver failure. So you can mention this, that's why we're going to admit you. Then invite psychiatrist to see, because it's a psychiatrist review. Why she tried to suicide? Okay. Okay, Jane. Why Jane tried to suicide? So it's not your task to do. Psychiatrist will assess. Or if the paracetamol levels are below treatment line, there is no need for treatment. We will assess you after a while, and you can go home after senior's permission. Remember, FY2 cannot send a patient to home, cannot discharge a patient. It's the seniors that discharge. So again, paracetamol overdose, it's an important scenario. When you enter the room, you know that you have to take the blood sampling. You ask a few questions about how many tablets, for how long, when did you take these, either you take with the water or any other liquid, or did you take one by one, or did you take all at once? Such kind of questions, so that you have an understanding that she has taken these medicines. And then MAM, past medicines, allergies, or medications, or past medical history. So then explain what you're going to do now. Take consent, perform examination, compare your warn the patient when you are going for sharp scratch, label vacutainers, and then compare. Excuse me. Okay, so compare your paracetamol levels on the normogram. You will see either it is above treatment line or below treatment line. If above, state this treatment, like you are going to start N-acetylcysteine for 21 hours. If it is below, then there is no need for treatment. It's simple. People usually doesn't make any mistakes in it. You can go through this in a while. I will show you the video. And vectonic colors. This is important. Blood culture. There are separate blood cultures. Portals, aerobic and anaerobic samples, and then light blue ovulation screen, INR, yellow paracetamol. Paracetamol samples would go in yellow bottle, purple FBC blood film, etc. Pink blood and group and save, and glucose and lactate for gray. So again, it's a simple procedure. I will show you the video at the end after doing this cervical smear. You have seen ABGs, it's a similar video. Let me show you the video. It's blood sample. Okay, I will show the video at the end. I will post it at the end in the group. So let's discuss about our last station, cervical smear. It's important. It comes in teaching as well. It comes as separate cervical smear as well. The important thing in this scenario is that the patient had lost cervical smear 10 years ago. You need to ask, why did she has this cervical smear 10 years ago? Why did she not come for cervical smear after every 3 years? You have to ask questions and then address them, because she had some pain. It was a distressing for her. That's why she did not have this cervical smear of in last 10 years. So we will see how we are going to address it. You are standing outside, you are good 90 seconds. You have two obs and gynae, Rachel Parkinson, 40 years old, come for the cervical smear, take brief history and perform cervical smear and address any concerns. Okay, so you have to perform this, introduce yourself, and check name and date of birth of the patient, and then I am here to carry out cervical smear procedure. In the state the purpose in the beginning that you are here for the cervical smear. So do you know what is cervical smear? It's the procedure that I'm going to perform it. And before that, I would like to ask you a few questions. When did you have your last cervical smear? It was 10 years ago. So why? It was distressing, doctor. Okay, I'm so sorry what happened last time. I will try to be as gentle as possible. If you feel any discomfort this time, please let me know. Then, okay, you have addressed it very good, very like lightly, and you have asked questions about why she didn't has this cervical smear 10 years ago. Now go for past history. Do you have any past medical illnesses, allergies, and medicines? And why? And keep in mind, while asking past history, there are contraindications: pregnancy, active menstruation, intercourse in last 48 hours, and PV bleed. While asking past history, you have to rule out all these contraindications, and that's how we rule out. Look at this. Do you have any children? Okay, that's fine. Sexual history, last intercourse, and contraception. So in that way, we're ruling out this intercourse in last 48 hours. Menstrual history, last menstrual period, we're ruling out pregnancy. Or you can ask simply that, are you pregnant? And active menstruation as well. And do you have any active bleeding? We are ruling out all these four contraindications in our history part. And then family history of any cervical breast cancer, because we are looking for any abnormalities in the cells. Then introduce that what we are going to do now. It's a speculum examination, involve inserting a small plastic device. This is speculum, these are the blades, and this is the node. This is then after explaining, take consent, and a chaperone will be provided, and ask the patient to empty the bladder and gather your equipment and perform speculum examination. Remember, when you're going to perform this speculum examination, it is possible that the examiner would be just behind you. He would be watching you whether you have located cervix or not. So do not stress out. Just be confident. Do your procedure. They are just checking either you are doing it in the right way or not. So just perform your procedure. So this is brush. This is the wrap. You have when you are going to gather your equipment in a kidney tray. You just unwrap it and gather all your lubricating jelly, so speculum, brush, and containers. And containers are thin prep and sure path. This is the containers looks like this. This is the thin prep, and then after perform, there would be only one container. When you perform the procedure, you insert the brush, you rotate it 5 times. There would be only one container, either thin path or sure path, thin prep or sure path. In thin prep, you have to dip 10 times. In sure path, you have to remove the head of the head of brush into the sure path. There are two things, two separate containers, and every time you have to do separate things. So you have to, if there's sure path, you have to do this, and thin prep, you have to tape it 10 times. And then at the end, label samples, and result will be 2 weeks. How would you like to take results? Either mail or phone, ask this to patient. I have written the general overview that at the age of 25 to 49, every 3 years, one get examined for speculum examination. After 50 to 64 years, every 5 years, and after 65, if they are abnormal tests. So speculum examinations are also easy. There's just one thing that you have to look after is why did she not have this speculum examination last 10 years, and the contraindications. You have to rule out all the contraindications while asking past medical history. Then you have to perform speculum examination. At the end, when I will receive the result of the question, there might be certain questions and their common mistakes. Do not explain and take consent from the patient, no proper technique, and do not label at the end. Remember, you have to do all these steps to get maximum marks. Always show that you are a safe doctor and a kind doctor. Okay, so that's all. We have done our 5 scenarios. I will be posting all the videos in the WhatsApp group as well. So if you have any questions, just let me know. Okay, any questions? Okay, online these procedures are difficult, but you have to make acquaintance yourself that how the procedure comes, how you have to approach the procedure. That is important. Your approach is important. How to deal with such scenarios if the procedure, if this scenario comes in the exam, how to start the procedure, and how to utilize your time and do the procedure in a right way. Do not waste your time in history taking. Well, all right. Well, then thank you so much. This class.